Hi everybody! Welcome to the BonnieWork YouTube channel. My name is Bonnie. I am a nationally board certified medical massage therapist. My goal is to help you increase and maintain your good health so you can feel good in your body and pass it on to the good people in your life. I got some comments asking for massage videos and how to deal with a really sore, tight neck. Well, these are really good questions. A really sore, tight neck is very, very common. One of the reasons are all those people and issues that are pain in the neck, and our heads are just so darn heavy on top of this little neck. When we are perfectly balanced on posture, it doesn't hurt so much, but we're not usually that well perfectly balanced. The way that we are built, we can round forward, and if you see, I'll show you this way, if you round forward, the head is out, and all of these are so tight. These are pulling as hard as they can to keep your head up. So that is a really terrible position. The other thing that happens is we get too stiff, so we don't move, and then we get really, really sore. So how do we fix that? Here we go. So hands on your neck. Go ahead and just get a feel for where the muscles are. Let's start there. So first of all, across here, you can feel the base of the skull. That's called the occiput. And the base of the skull has muscles that continue all the way up. It's got fascia, connective tissue that continues all the way up. So if you actually start to massage the back of your head, you are going to be starting to release those muscles that are below, but you're releasing the connective tissue that is continuous all the way down, all the way around. Even this part here is continuous all the way up to there. So it doesn't really matter where your neck hurts, because we're going to approach the whole neck and above and below the whole neck. So if you continue running your fingers, go ahead and just do it. Run your fingers, along that area, kind of base of the skull, behind the ear, all the way up in the back. You're starting above, and there are definitely issues up there. All right. If you feel that you need to go even higher up, go ahead and mesh your hair up, do the scalp tingly thing. Oh, it just always feels so good, relaxing, good. Yeah. So then we're going to go below the neck. So all of these muscles here support that neck. They support that neck. Yep. So we got to do both sides. So go ahead, do this. Run your fingers all the way up around the back, your upper back, toward the neck, toward the front. And then I'm going to show you what these muscles actually are. So this one, do you see me pinching it right in there? That is upper trapezius. Upper trapezius, yeah. And you have one on both sides, so let's do that one on the other side. So go ahead and you just get your fingers and you pinch and you run your fingers up. Now, if your skin happens to be really dry, you can use oil or lotion. Oil lasts longer, but it's a little messy and it can stain your clothes. Lotion goes away really fast once you rub it in. You have to keep applying it. There is massage lotion, which I prefer. That's what I use in my practice, massage lotion. You can also use water. Rolfers often use water if they need a little bit more glide. Okay, so we've worked both upper trapezius there. The upper trapezius goes all the way up the side of your neck and attaches to the neck bones. The cervical vertebrae are what the neck bones are called. let's go and actually work the cervical vertebrae. So I don't know if you can see, but go ahead and follow me. Bring your hand to the back of your neck. Feel for the bones. You're going to feel one at the base of the neck that sticks out, really sticks out. That's C7, cervical vertebra number 7. So that's the lowest one, the very last one before the ribs start. And what I want you to do is run your fingers on either side of the cervical vertebrae. So let's say the cervical vertebrae are here, right in the middle of the back of the neck. And you're going to take the muscles on either side of the cervical vertebrae, and you're going to sink your fingers in there. You're going to sink them in on either side. So do one side at a time. So you want to pull the trapezius away first because they attach there too. And then you want to get right between the muscle and the bone, all along that cervical spine, that neck vertebrae. And go ahead and move your head at the same time that you're doing a little massage, because this is actually neuromuscular re-education, big fancy word for when you move while you're massaging, you're helping the nerves and the muscles talk to each other again. All right? So after you do the one side, go to the other side and find the vertebrae again with one hand. Take the other hand and pull the muscles away from that vertebrae. Now, if any of this hurts, don't do it. It's not worth it. There could be something else going on, or you're doing it too hard. So you may be working too hard on it, and you can just go softer. Really, really often, a softer, lighter touch is more effective. If you do a touch that is too hard, your nervous system is going to defend. It's going to protect against that, especially if it's painful. So you want to do just that softer, easier touch. So instead of kneading, which is what we're doing here, kind of like kneading bread, right? like everybody's already done that, right? In the old days, maybe. So anyway, this is like kneading. Instead of that, maybe you just want to do super light, gentle hands-on. Just gentle hands-on and melt through that connective tissue. Melt those muscles. That is absolutely valid. And sometimes that is the best way to go after it. So we're finished with the muscles right along the spine, the paraspinals, and all of those major muscle attachments are along the spine. Now we're going to come around to the front, okay? So what you're going to do is very gently, find the side muscle. It's this softer thing that sticks out. It's not super soft. It's got a rigidity to it because if you're leaning one way, it's stretched. If you're leaning the other way, it's contracted to do that leaning motion. These are the scalenes. They're called scalenes, and they're attached to your vertebrae on the neck vertebrae. But you can follow them down with your fingers. Go ahead and do that. Feels really, really good. Again, not tight, not hard, not too much pressure, but nice gentle motion downward. Great. And let's do the other side. So find those scalenes again. Find like the side muscles. There are all those muscles that are on that side there. Now there's two more things I'm going to show you about the scalenes that are really important. They attach to the neck and then they attach down to the upper rib, which is just behind your collarbone. Yeah. And what's so important about this muscle or set of muscles here, there are three main scalenes here, is that they have the nerves for the whole arm going right under them, right between them. So the nerves come off of the cervical vertebrae. They're underneath those scalenes. And then they go through under the collarbone and then they come out in the underarm there. And then they go and they kind of fan around into the rest of your hand. So the reason that we're talking about the brachial plexus, which is the nerve grouping for the arm, is that if you go way too hard in here, you're going to mess up your arm. You may feel tingling, you may feel just numbness. Now, if you already have tingling or numbness in your hand, it's very likely that the issue is from this area being so tight, especially if you have a tight neck and you have tingling in your fingers. It's not always from the hand itself if you have pain or tingling there. It's very often from the source of the nerves. So, in order to fix or work on and release the nerve issue there, we can soften the scalenes because they can create a nerve restriction. So we want to soften the scalenes all around. So before on this side, we just did a lot of gliding there. And this side, I'm doing a little bit of kneading because I happen to be tighter on my right side. So I might need some of those. Now be gentle. There is a carotid artery in here, but it's pretty deep. So it's pretty hard for you to mess it up. Just don't go really deep right here. You know, just work on, you can even just work on the skin, and that will also very much help. The other interesting thing I wanted to tell you about the scalenes are, put your hands there just above that collarbone, just a little bit to the side, and sniff. Feel them tightening? Those are the scalenes. They help raise the ribs when you breathe in. So you can always tell if you're on the scalenes by sniffing. All right, so we've done the muscles right along the spine and all the attachments. Now we've done the scalenes. Now what I'd like us to do is to bring your hands around again to the occiput and come right underneath the occiput, just at the base of the skull. So you're going to feel that bony, hard skull there, and where it goes inward. And sometimes it's soft, but usually it's pretty tight, especially if your neck is tight. You're going to just sink slowly in. And I want you to move your head up and down as your hands are going underneath the skull there. These are called the suboccipital muscles, and there are a lot of muscle attachments there. And it's such an important place. There's so much tightness in there. A lot of times if you have a lot of tightness and pain here, you're going to have a headache right up in here or in here. One of the reasons is that the nerves that go up the occiput, I'll show you the line, they go both sides up all the way around here, but then the nerves that are coming from here meet the nerves that are coming up from the occiput. So that line of nerve, if you have any tightness or nerve restriction, you could have pain anywhere along that line. So you might just feel it like, here or right behind your eyes or, somewhere just in the back of your head. A lot of times they'll feel a band around the head, really, really tight, holding tight. And that could very well be just from tightness at the base of the occiput. All right, so now that we've done most of the neck, we're going to do a little bit more in the upper back to kind of soften those. So since you released the neck muscles a little more, these upper back muscles need to kind of be more cohesive and integrate back in. So I want you to be doing what I'm doing. Move your arms, move your hands along that area, spread it, knead it. Yeah. Just make it a little easier and a little softer. I want you to move your head when you're moving your hands along the skin and along that connective tissue. Okay. The last thing we're going to do is just massage the face, because often when you're massaging around the neck or a really tight area, you're going to make, oh, that hurts. Oh, that feels good. And then your face gets kind of tightened up. So we're going to soften around the face. And again, remember those nerves that come up from the occiput come up all the way around? Well, they're right here. So we want to make sure this place gets nice and soft too. Just softer, softer. Yeah, and feel that releasing all the way around. Good, good, good. And then, oh, soften your smile muscles. Soften the jaw. Yeah, it's pretty easy to do all this. Go under gentle here. It's very soft. There's a lot of lymph nodes under here. If you feel any bigger, harder, roundish things, those might be swollen lymph nodes. Just keep an eye on those. If you have allergies, you usually will have swollen lymph nodes. But also it's a sign if you feel like you might be getting a little sick or a little ill, then you know to do your remedies and drink a lot of water and good fluids. All right, and then we just do a soft, yeah, just a softening here, and we are done. So I hope that this helped you to feel good in your body. I hope you pass this on to somebody else. Maybe you can do it for somebody else or with someone else. And I hope that you subscribe to BonnieWork so that we can do this self-massage healing work together again. Thank you so much for being here. I appreciate you.